A Knoxville woman kicked COVID, but lingering symptoms are proving to be worse than the virus.
Over the course of a year, Pam Bishop has made 40 doctor's visits, seen 16 specialists, and had to quit her job. Now she's hoping a clinic devoted to COVID long haulers like her can restore her health and hope.
Pam Bishop pictures her past when she was active and healthy. The wife and mother of two longs for those days that COVID has stolen. More than a year after she caught the virus, debilitating symptoms like tremors and extreme fatigue grip her body. Pam is what's now called a COVID long hauler, people who have a wide range of symptoms weeks, even months after they recover from the virus.
It wasn't the plan that I had for my life.
The Knoxville woman's new reality led her on a journey to Nashville and the post-acute COVID clinic at Vanderbilt Medical Center.
Well, we started thinking about this clinic in December 2020 when it really started to emerge that there was a large population of people who just needed help. And they were looking everywhere to find doctors who were willing to listen, specialists who were willing to acknowledge that the condition even existed.
Dr. Sapna Kripalani says long haulers who come through the clinic are plugged into their specialists and resources. Those doctors in turn gather data and research.
That there's some things we know and there's so much more that we don't.
Tell me a little bit about your symptoms.
The main symptom that I have is chronic fatigue.
Patients like Pam are their partners in solving the mystery of long COVID.
What am I missing? It's just so much.
On this day, Pam is meeting with a doctor who specializes in autonomic dysfunction.
You were infected with COVID in 2020?
There are questions, a physical, an assessment.
You do meet criteria for a condition that we call postural tachycardia syndrome.
Postural orthostatic tachycardia syndrome, also known as POTS. It's a disorder that affects blood flow and leads to symptoms like lightheadedness and rapid heart rate, symptoms that Pam and other long haulers are experiencing.
At least 50% of them, they always say there is an infection or something that has triggered the disease. And now we're seeing that with COVID as well.
An answer for Pam, but not a cure.
The symptoms may not go away completely, but they can be controlled.
What I can do varies day to day. You'll see I've taken up a houseplant hobby since you were here last time. I really needed someone to pull it all together and say, you know, this is what it is, and we can help you.
3 weeks after her visit to the long COVID clinic, Pam is following her doctor's orders.
I have an assortment of things that help get me through the day. Noise-canceling headphones. I have a pulse oximeter, and this is my weighted blanket.
She still has days she can't pull herself out of bed. While she mourns the loss of her life before COVID, Pam says she's gained a new perspective.
I am now working on accepting that this is life now, and you know, there are limitations to this life now with this illness.
Dr. Kripalani estimates at least 30% of people diagnosed with COVID experience some form of long-haul symptoms. A research clinic here in Knoxville is conducting a clinical trial for long COVID. For more information or to see if you qualify, call this number. It's 865-305-DRUG, and we have much more information right now at WBIR.com.